So the question came in, I've recently started working on the PV side of a large health network, and I'm overseeing the key code and comparison code process. I've done mostly facility coding, so this is a whole new area for me. Can you provide any insight on this or how other facilities handle this? When I saw this question come in, I pounced on it because I thought, oh, okay, I know exactly what they're talking about. But then I read it again, and then I sent a call to Jennifer and said, you know what? I don't think this is what I thought it was. So we talked about it a little bit. And just a heads up, the person that put in this question didn't give us permission to use their name. We ask, and which they probably don't care, but still, if we don't hit this exactly with what you were talking about, let us know and we'll go back and redo it. Ultimately, this is all about statistics, right? That's what key codes and comparison codes are about. For example, we in the facility side, they want to do comparisons for how many people have MRSA. You know, are they treating for MRSA? How many people have antibiotic resistant MRSA? Right? And how many people have had a fall? How many people have had, are they treating for diabetes? How many people that have diabetes that have had an amputation, et cetera, et cetera, et cetera, you know, because they are using that information to determine how much money the facility is going to generate because of the diagnoses. And that's how inpatient or facility is done, and our person who submitted this question has done facility work. Whereas with outpatient, it's completely different. It's not based on the illnesses that a patient has. It's based on what the providers are doing for the patients. So in that key comparison, they would be looking at things like how many new patients are we getting in a specific amount of time? How many times are our established patients coming back? How many of our established patients came back for flu shots? How many established patients are getting their preventative care done? Our colonoscopies, our prostate examinations, our breast mammograms to make sure we don't have cancer. All of those they're wanting to have done, and statistically, the payers pay for those to be done because they want early detection if there's a problem, because it costs the payers less if we catch cervical cancer early as compared to late. So of course we want them to come in and get their PAPs done. Now, it's not just about that as well. It could be how many of our patients, again, are we treating that have diabetes in the outpatient. We need to know, because maybe it would be beneficial for us to hire a diabetic nurse or someone to come in and do the toenails of a patient, our diabetic clients, because there's not a podiatrist in the area. And so things like that, they're projecting it's statistics, and they want to know the cost, the key codes and comparisons. Is there an easy way to do that? It's all done in the computers, the different platforms that you use. Now, third-party administrators, TPAs, do this, and I suspect that our person that asked this question ended up getting a job with a TPA. So what is a TPA? They are a third party that handles the administration side of doing many of these services and collecting statistics for you. And they can be also organizations that collect the premiums and issuing reimbursements and stuff, and helping to pay out medical claims. They do several things, though. It's only limited to the services that they provide. As we scroll down, we'll see some of those services, and the top this is the largest third-party administrators, and I think this was, would have to look at the link, 2018, I believe, is when this was out. You may be familiar with some of those, and if you're not, it's not surprising, because TPAs are hired by large network providers to help them with the behind the scenes, the business side of running an outpatient or even a facility. So as we scroll down, now that you've got that, and again, I linked that in the footnote so you can get more. It came from a great article about TPA. So what services are we looking at, and therefore what statistics that this person needs to be aware of for those key codes? They could do just the administrative services, but they could also be doing auto liabilities, professional liability, maybe medical malpractice. They're pulling the statistics, pulling these codes to find out what the payer needs to be aware of, as well as the provider. The next page here will give another list of some of the top things that they provide for. Loss and control programs, emergency response plans. These are all things that are based, again, statistics, loss and adjusting, industrial hygiene inspections. How about return to work programs? And I thought workers' compensation audits. If you are a coder and you've ever met a coder that's involved in workman's comp, it's everything about workman's comp is a separate identity in and above itself. The payer for workman's comp does stuff different than anybody else. Also forensic accounting. Now, when we say forensic accounting, that may make you think, what are we talking about exactly? Think of forensics go in and do an investigation when, say, somebody's injured, or say, let's say somebody's a homicide shows, forensic files and things. They go in and they investigate to see what was the cause of the problem, or what was the cause of anything. Maybe there's an uptick in some diabetic encounters, or maybe it's going down. They want to know why, so they do a forensic audit. And again, that could be what our person is talking about. They also involve, a lot of times, counseling. And again, that's because of the statistics that they're doing. They could do only the statistics. They could do counseling, and they could do other services. Again, it's only limited to how big the organization is that you hire to do these services for you. But most of will do counseling as well. So not only are they identifying what you need to have done, or they're providing a service where they're coming in and doing the behind the scenes, the business side for you, but when they see a statistic that needs attention, they'll come in and give counseling, provide counseling. So you could be hired as a coder or through an attorney's office to help with that. I know that Chandra, that used to be with us, a lot of you guys know her. She has lots and lots of credentials, and she did work for an attorney, and all of those statistics were specifically so that she could train and counsel these organizations that were struggling and having problems. And I think that's it. If you have any other questions about TPAs or the codes that are commonly used in comparison and stuff, think about high revenue codes. So facility, it's all diagnoses. Outpatient, it's going to be based on age, demographics, and geography of an area where you live. And again, it all boils down to statistics.
Do you need more medical certification and business training? Learn more at www.cco.us.